Go ahead.
Okay, so thank you for inviting me, Dr. Dolce. I appreciate it. And, you know, you asked me earlier about what prompted me and us to do what we're doing, right?
Yes, sir.
And it all started a number of years ago where, my partner Jack and another friend of ours who's my partner in another company, a lab man, we were trying to figure out what was wrong and what we were having challenges with in the full arch implant world. So over the years, I came up with a list of 25 challenges that afflict most every case that's out there. Not all 25, but
Right.
there are cases that a bunch of them become apparent. And they're the ones that drive the dentist, including myself, nuts. I've done, a couple thousand of these arches and realized at one point that if I could eliminate these stresses, I wouldn't have as many gray hairs. I wouldn't have as many wrinkles, and I'd be able to get through the cases a little bit more fluidly, right?
Right.
Because ultimately, I want to do more of those and I want to satisfy more patients, but I could do without the added stress. So we took the current systems in the marketplace today, and I'm not going to mention any names because we're recording, but you and I both know who are the players out there, right?
Yes, sir.
And I've used them all.
Okay.
And we realize that they all are dictated by the implant position. So the entire prosthesis, the entire evolution of the design and the case is dictated by where this dentist wants to place these implants.
Right.
But when you fast forward the surgical visit and you realize that not everything turns out the way we planned, because no matter how good these CBCTs are, you and I both know that many times you get in there, it's like, what? This isn't what I saw, or it's not as bad, or it's not as good. Whatever it is, there's some deviation from the reality.
Okay.
And we realized that what the dentist was losing is the whole project was based on a denture. So you and I as dentists, we would take impressions, or the patient already had a denture, we duplicate it, we send it off to the lab. And the lab makes me an immediate denture. And it's based on the references and the information that I picked up from a scan or an analog impression. And now I went to surgery.
Right.
Once I extracted these teeth, or if the teeth were already gone, once I flapped the mucosa and I leveled off the bone and I cleaned up my surgical site, especially on the lower jaw, it's much more difficult. All of the reference points were gone. So now this denture just floated around in space.
That makes sense. Yeah.
You're laughing because this is what happens. It happened to me, hundreds of cases. And I'm scratching my head and saying, now what, right? So I go do my implants, blah, blah, blah. Now I got to orient this floating denture and hope that it ends up right where I want. Hope that the midline is good. Hope that the cant is good. Hope that the vertical is proper. And you know what? There's a lot of hope. My grandmother was called Hope. That's about as far as I would take hope. Because hope is, in what we do, is just not good enough. So what we decided to do is figure out, okay, so if the crux of the problem is we're losing reference points.
Okay.
So we had to design something that kept and maintained my reference points no matter what we did to the surgical site. No matter how much bone I removed, no matter how many teeth I removed, we had to do that. So we came up with this plan. It's called the Smile-in-One system. And it's got some patented, trademarked reference markers. And these reference markers, they never go away until you're done with surgery and you remove them. So it didn't matter. Getting back to the original question, we came up with the practice here in Alabama alongside the training center because I needed to finish and do a few more of these Smile-in-One research cases where I could film them. But as I was planning this out, I realized, man, I've got to buy a dental chair. I've got to buy a CBCT. I need to buy an iOS.
Yeah.
I needed to buy pretty much everything I needed for a practice. So, all right, so let's build a practice.
Mm.
And then I said, okay, so I got to plumb the video on above the surgical chair
Yeah.
into the classroom. So I could have 10, 20, 30 people in there listening and watching the surgery live. Then I had to connect the door from my surgical suite into the classroom so I could, at a moment's notice, just walk out and tell them, I'm going to do this. I want you to watch this very precisely.
Okay.
All the while, I'll be wearing a headset that has a microphone so I can hear the professor or whoever's in the classroom that's narrating say, hey, Nilo, I got a question from this doctor, and they want to know, why did you move the flap this way? I'm just being facetious, right? Okay, so I can answer them and they can hear me. So I said, all right, as this was developing, I said, what a beautiful novel idea. Why? Because me as a dentist, when I, in years ago, bought a Carestream scanner, I went to the Chicago Midwinter, I saw it, I used it on a plastic dry model with no saliva, no shadowing, no lips, no cheeks. Oh man, that thing worked great. Let me buy it. I get it to my practice. It's $30,000, and we can't get the same results that I got at the show. So I used it again and again, and I'm not knocking Carestream. They're a wonderful company. So I returned it. And then I ended up buying a different one. I bought an iTero. Why? Because I did a lot of Invisalign. And then I realized, man, I just paid 40 grand for this machine. I got to pay $380 a month to be able to have the right and the privilege to use the darn thing. I mean, you know, I realized that, yeah, I had a title above my name here. My forehead said dentist, but on top of it, illuminating in an LED, it said, pretty stupid.
Schmuck.
From a business perspective, it didn't make sense to me. And I'm a very bread and butter kind of guy. And I do like bread, by the way, especially good Italian bread. But
me too.
So I said to Jack, my partner and your friend, I said, you know, we've got to just kind of bring this all together, right? So if we were creating a church, and I don't mean that I'm a pastor or anything, but if we were creating a church and you bring in your parishioners, what is the object? Is to get them involved, keep them on the path of righteousness or whatever it is that you're teaching, help them not make mistakes, and if they ever do, be there for them for support, for clarity, for guidance. And I said, let's create a type of a church and that we can help the dentists hopefully minimize their mistakes, become more efficient, save more lives by helping more patients, while at the same time helping their practice and their own families, right? So I said, you know, that would be a good thing. That would be a good legacy that Jack and I can leave behind to dentistry if we can do a little bit of good to help people just be better. And that's where this all started, right? So fast forward to now, where Jack and I have, 42 companies, I believe, that we represent through Quantum. And we've specifically vetted these products and company. So rather than say to you, Doc, I'm going to sell you composite, I'm going to sell you flowable, you know what? You can buy that from 3,500 different people. That's not what we're going to do. What we're going to do is say, look, if you want to get into the laser world, for example, we're going to show you a wonderful product, a wonderful machine, priced incredibly well, more aggressive than anybody else. And more than that, you can come to the practice, see it for yourself, hold it in your hands, see how easy it is to use, and then make your decision, right? And if you want to end up buying it, yeah, we can help you with that too. Same thing with an iOS. So in today's crazy world of digital dentistry, and it's all evolving towards that, as I look at the statistics, it's less than 29% of the dentists actually have digital technology. That means that 3/4 of the dentists out there are still using analog technology But you and I know, because you're a practicing dentist or was, and it goes back to your lab now. And nowadays, not before when you and I were younger, where, you know, you had technicians that did lost wax and all that. None of that's going on.
Right.
But your analog impression goes back to the lab, and the lab sticks it in a box and hits a button and digitizes it.
Oh, okay. Okay.
That's what happens. Because you got a bunch of lab guys now that are computer geniuses, but lab wax idiots. And I don't mean that in a derogatory way. I just mean that in a reality way. They're wonderful at using exocad and 3Shape and all these things, and they design these beautiful prosthetics, but they're not making them with their fingers like the old guys, right? The gold people, the PFM world. I'm a lab tech. I did that. I did wax and I did sprues, and oh my God, it was crazy. And that's the world that we're in right now. So we realized that in order for quantum to be successful, we needed two components. We needed vetted, proven technology that a dentist can pick up and use. But I didn't want dentists to keep buying stuff and have those things become the white elephants in the corner of the room. You know, we all bought stuff that we just don't use. It just sits there in the corner.
Yeah.
I mean, I recall a CEREC machine that I bought years ago, and it just sat there because the material wasn't opaque enough, and I put it on an implant, the gray showed through. I mean, I know they've improved it now, but I'm talking about 2001 when I bought it.
Right.
This is a long time ago.
20 years ago, yeah.
It was 120 grand back then. So I'm still getting grief from my wife about that purchase. Still. So going back to the twofold, the second part was I wanted a dentist to be able to come to this quantum facility, this quantum church type, and say, hey, Nilo, I want to see the CBCT.
Right.
I want to see how it works.
Yep.
I want to see how easy or difficult it is to plan a case, evaluate some TMJs. I want to see the sinuses, airway. Okay, great. So come on in and let me show you, because I'm going to use it on a regular basis. And then you can decide, right? Same thing with all the things. So why go spend $30,000 or $40,000 on an iOS that you have to pay a licensing fee per year when, if you and I both know, if you've got 3 or 4 operatories and you're cutting a bridge in one room and your hygienist is trying to scan for a night guard in hygiene, somebody's going to be waiting for that iOS till you're done.
Yeah.
So I say, listen, there's great iOS machines, and we sell a couple of them, that you can have one in every room. They're inexpensive enough that you could have one in every room, but you don't have to. You could have 2.
Right.
So that you can become efficient, because the whole object of this, you run a dental practice, you want to be the best dentist, you want to be efficient, you want to be profitable.
Yes,
and you don't want the patient sitting around and waiting. Right. Most people don't have the time in their lives to be waiting aimlessly in a waiting room or in an operatory for an iOS machine to come.
Well, you also want them to be impressed. I mean, I have a prosthodontist that I worked with here in Colorado, and he's still taking impressions. I mean, I'm like, okay, how come you don't have a scanner?
Yeah. But you know what? You're not going to change some of those old dogs.
Right.
You're just not.
Right.
And to try to push this thing on them, the uneasiness about it is too much.
Are you kidding? Listen, I bought a laser, I bought a scanner, I bought all these things. Nobody ever showed me how to use it, honestly. Even the rep that brought it to me, I wound up learning more than him. You know, to have this advantage, this is worth $1 million to be able to come to your facility.
Well, because it goes back to, what is it that dentist needs? You know, a long time ago when I was doing a business course that I was involved in for a long time, one of the things that really resonated in my head was always get into your reader or your listener's shoes.
Right. Right.
What are they getting out of this, right?
Yeah.
What do they need? What is troubling them? Because if you can answer those questions, now you become a team. I don't want to be the guy that somebody comes to one time, buys one machine, and they never reach out to me again. No, 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 no. If you buy an iOS, wouldn't it be nice to have seen it in use in real clinical application? And
Yeah.
this is how we're going to use it. These are the challenges that you're going to find yourself. This
Right.
is what's going to happen if you have a small mouth, limited opening, right? So I mean, look at the size of the Itero's camera head. It's humongous. I mean, I had patients
Yeah.
back in Florida. I couldn't use it. It wouldn't fit. So
Right. It
little
was
old
big.
lady. Yeah. So I mean, it's a great machine, but technology evolves, and so do we, or we should, right? So that was one of the things that I was looking at. We need a smaller machine, a smaller head that can get
Yes,
into
sir.
the smaller areas
Yeah.
and be effective. The same thing with the laser. So when you look at the big competitors out there, the Photonas, the Perolays,
Yeah.
the the Biolays, right? I think you had
Water
one.
lays. Yeah. I had a water lays. Yeah.
So if that thing ever breaks down, you got to go buy wood, build a crate, or you got to take it someplace for a few $100s to have a crate built so you can ship this thing.
Mm-hmm.
And
Mm-hmm.
I said, how does that make any sense? It's not good. It's not okay. So the one that we're promoting and the one that I have, actually I
Okay.
have two of them.
Wow.
If anything ever goes wrong, it's all in the handpiece.
Wow.
You put it in a
Okay.
little tiny box, which is a flat rate USPS box at $7, and you ship it. That's
That's
it.
it. That's it.
The
Okay.
rest of the machine, if anything ever was to go wrong, it's not a huge problem.
Okay.
There's nothing in the rest of the machine. Basically, it's
Okay.
power and water. That's it. So all the important stuff is in the handpiece. When we looked at the iOS, same thing, right? Why? Because you're from New York. In New
Yes, sir.
York, the per foot rate to rent a space is astronomical.
Yes, sir.
I'm in Alabama. My space here is 3,400 square feet. My rent is $3,000.
Oh my God. Oh,
You see what I'm saying?
oh my God. That's crazy.
What would that cost you in New York or Los Angeles or even Miami?
Oh, how about West Palm Beach? Mine was three times that in West Palm.
That's what I'm saying. Mine was 11,000 in Miami. So when you look at it and you say it's all relative, of course it is, right? But when we're dealing as a clinical dentist, the human body is not relative. You have people with a big mouth, you have people with a little mouth. You have people that gag very easily, and you have others that don't. So the human is really an interesting animal. We're all different, right? And you have the ones that get anxious and they clam up.
Yeah.
And they don't want to open or they don't say anything. And then you have the other ones, like my wife, that when they get a little nervous, they yap a lot. They ask a lot of questions and they giggle and they tell jokes. That's how they present their anxiety.
Right.
And we have to take that into account.
Yes, sir.
So going back to where we were, and I said, okay, so let's build the quantum training center
Okay.
so that the dentist can get some additional education, with CE credits and all.
Right.
But why? Because every week I probably talk to 10, 15, 20 dentists. Some of them are old students. Some of them are new clients that come from our YouTube channel and come from our different sources of advertising. And invariably, they ask certain questions. So I have dentists asking me, well, you know what, but this economy is getting really bad, and I'm not having patients say yes. I said, great. So we've got to figure out a way to help them with that, right?
Right.
And is it training? Is it coaching? Is it? I mean, there's no magic bullet. You know that as a consultant. But if we give them some good foundational structured training, they can evolve from there. And the same thing goes with hygienists. We just brought in a hygienist educator, a speaker. She's out in California, and she's wonderful. Just talking to this girl is what a wealth of knowledge. But she's not your typical cleaning girl, right? She's more than that. Actually, she wants to be more of an educator and less of a clinician.
Right.
And that's what we're looking for. So the Quantum Dental Training Center is going to be able to exercise an ability to bring dentists in based on what their needs are.
Yes, sir.
If you want to learn how to present treatment, we'll be able to coach you on that with good, solid. As a matter of fact, I published a book. It's on my website. It's called The Mind of a Closer. And it's all about closing comprehensive cases, full arch cases. But more importantly, it's about how to coordinate and train your treatment coordinator. But you can't do it by yourself. It's got to be the dentist and the coordinator.
Yeah.
It can't be one or the other. It's got to be both, right? So team, and everything works better in a team format. So when I talk to hygienists, and I've got a lot of hygienist followers on LinkedIn, especially, it's the same thing. What are they doing? They're cleaning plaque, they're cleaning calculus, they're polishing teeth, right? And I said, there's more to it. So we get into it, and I said, okay, but let's say you have a traditional, everyday, normal patient. They come in, they get their teeth cleaned twice a year, because that's the misnomer that we've all been led to believe because of the insurance companies back in the day. And you give them some fluoride treatment and they leave, right? So, but for some of us that are non-fluoride believers, like me, I don't care for fluoride. I have a kid in medical school, another one in law school. They've never had fluoride. It's just what it is, and they have no problems. Their teeth are fine. So you have to be able to circumnavigate these different types of people. There's a lot of people in the natural workflow, in the natural existence. They go and they want more organic foods, want more grass-fed beef. And those patients, you can't just shove fluoride down their throat, because for the most part, they're either going to leave your practice. And in this economy, do you want patients leaving your practice?
No, sir.
You want them to stay. So you have to be able to open the doors and invite more people from different walks of life. And the same thing goes for our training center. So I do a lot of biologic and holistic therapies. If a dentist wants to come in and train on that, we're happy to help them and train them on the uses of ozone and the uses, different things that they can utilize to improve their practice. If you want the traditional method, the drill and fill fluoride, we can do that too. All I'm saying is different strokes for different folks, right? There's some people that don't eat red meat. There's vegetarians. And why do dentists sometimes think that what I say is gospel and that's what it is? No, it's not. We're selling a commodity, and the consumer has the right, and really they have the opportunity to select who they acquire these things from.
Right.
So the same thing with education. As a dentist, especially as a young dentist coming out of school, the last thing you want to do is waste money. You want to find one path or one channel of education that you can really believe. I'm going to start to sound like your wonderful coach, Nilo. You got to believe. And if you believe, then you buy into the gospel that we're trying to promote. It is being efficient, being very professional, being very accurate, and still understanding that the human is going to be the variable. The human as a provider and the human as the recipient, meaning the consumer. And it's not going to change. That's what it is. So are we going to please everybody? Of course not. I don't expect to. But what I want people to understand is that in order for us to get the word out, we need people like you. We need people like other independents and consultants that are finding similar challenges to what we're finding, right? And the way that we help each other is by becoming a bigger team. That's all. So listen, you're in Colorado. I know a few dentists in Colorado, but I don't have any representation in Colorado. Who better than you? This lady, Cindy, she's in California. That's wonderful. Now she's in California. So you start spreading out the information and the gospel across a larger swath of land, right? So the power of a man, I've always said, and that's in another one of my books, the power of a man is not measured by how much money you've got. You know, fraudulently, we believe that the more money you have, the more power you yield. No. The power of a man, in my belief, and this is my opinion, is how far out into mankind and humanity you can affect a positive change. Because if I can affect a positive change in a dentist in Alaska, for instance, that's just emailing back and forth, and I can help them do something a little bit better, I did a good thing. And that person doesn't forget. Yeah. So it's all about being the best we can be, helping as many people as we can. So when it's all said and done and we get judged, hopefully, you need 70% or above to pass. Hopefully we get 70%.
Hopefully we pass.
Yeah, and that's really what this is all about. It's just about helping people.
Yeah, I mean, to me, anytime something came out new, I tried it and I brought it in my practice. I didn't need, I was, I guess, ahead of everybody. I can't believe the lack of embracing the new technology the dentists have today compared to me. I mean, 20 years ago, I had a laser. 20 years ago, I had iTero. I had all this stuff, and I would have had a CPC if I had kept practicing. I mean, they have so much advantage today that we didn't have when we came along.
You're right. You're right. And we all started the same way. I mean, you and I got licensed in 1991.
I beat you.
You may have beat me by a little bit, but what I'm saying is you and I both started with these composites.
Right.
And my first curing light was an ultraviolet blue light.
Right. Me too.
And shortly thereafter, that became obsolete and I had to buy a visible light.
Right.
It's like, oh my God. But back then, those curing lights were $1,800.
Yeah.
It's like, man, I got to throw this junk out because it doesn't cure the composites. So then I bought this Denmat light back in the day. You remember them?
Yeah.
But it would cure some composites, but not all composites.
Yeah.
Why are they doing this? So, we've gone full circle, and any curing light, even the cheap ones on eBay, they cure the stuff. They're not as powerful, but they cure the stuff. So it's a good thing. Dentistry has come a long way. You've been a dentist longer than I have, but probably not by very much. I say that I've seen the evolution of dentistry since I've been in practice, since 1991, 5 times.
Right.
You've probably seen 6 or 7.
Yeah.
But I've seen 5 monumental evolutions in our ability to provide care. And I think this is just the beginning.
Yes, sir.
This digital dentistry now.
Oh, I want to go back and practice again. I'm jealous.
Hey, listen, get your Alabama license. Come on down. You can have some fun here. But given that in where we are today, there's 2 things in my mind that a dentist needs. And neither one of those 2 things is technology. Neither one. They need a very good demeanor, more friendly than not. I had a dentist yesterday tell me that they just don't like people. Mind you, he's telling me he's struggling, he's not making enough money. And then he's saying to me he just doesn't like people. That's tough. That's tough. I mean, you have to make a conscious decision the moment you wake up in the morning and say, I love everybody. Yeah. Because if you go in with that mindset, it opens up a world of possibilities. But the second thing that the dentist needs is good interaction and conversational skills. Whether it's in case presenting, whether it's in closing. So here's a copy of the book. I don't know if you can see it there.
Pull it back.
Let's see.
I'll get it out to people. Don't worry.
Well, here. Can you see it there?
Yeah, move it to your right a little bit. Oh, the other way. Right there, right there, right there.
There you go.
I love it.
Okay.
All right, I want a copy.
I will send you a copy. They can download the ebook right from our Quantum website.
Okay.
Okay. And if they email you first, I'll send you the PDF because it's $10 on the website to download it, but I'll send you the PDF so your personal clients can get it for free. You just send them the link.
Okay.
And they can get it. It's really interesting because there's two people that have been instrumental in my life. Well, more than two, but there's two people in particular that have been instrumental in my life as far as case presenting and sales. And one is Paul Homily, Dr. Paul Homily, and you probably know.
Yeah.
And he just went through a pretty bad health scare.
Oh, sorry.
But he's an old friend. He's doing great. I spoke recently. And another guy is a man by the name of Don Barton. People can download Don Barton's book for free from our website, the ebook.
Okay.
So Don is not a dentist. And between what Don teaches and what Paul teaches, I made my own hodgepodge of stuff and the business course that I did years ago. And I came up with this approach because I realized that my wife, when we were in Florida, if we went to buy a car for her, she wanted heated seats, heated steering wheel, and big fat wheels. And we were in Naples, where cold weather is 77 degrees.
Right, right.
What do you need a heated steering wheel for? Well, you got to have the best, right? So that's her mentality. Whether she's buying a burger or she's buying a car, her mentality.
That's good.
Then you have people like my dad, who's a wonderful human being, has made a lot of money in his life, but he's your Walmart, Target, TJ Maxx guy. He's happy, so happy he calls me on the phone when he buys a pair of irregular tennis shoes for $10. So you have the two extremes. Gotcha. You have, according to Don, you have 3 to 5% of the people that are going to get the very best all the time.
Okay.
And 3 to 5% of the people that are going to get the very cheapest, whether they're buying a TV, a car, or a denture. But the rest of the people fall in between. As a dentist, unless you understand that, when you're presenting a crown or a denture or a full arch, how do you know which sphere they fall into? And you only find out by asking questions and listening. You got to listen to everything they say and understand that they're going to give it away every time. They're going to say things that if you're intuitive enough to capture it, you know where they fall. If you pick up that they fall in the very best, like my wife, guess what I'm presenting?
The best.
The best denture, the very best crown, the very best aligner system. I'm not talking about the cheapest. Why? Because that turns them off. But if you got a guy like my dad, who's wearing irregular tennis shoes and a regular shirt that has the label cut, that's my dad.
Okay.
So when they come in, they give us that information that we need. So when I'm presenting to my dad, I would say, listen,